All right, let me introduce our three wonderful guests to you. I'll start with Dr. Wesley Quadros, who is the founder of First Embrace. And this is a charity that's aimed to improve newborn survival in low resource settings through evidence-based cost-effective interventions, including, I think, particularly kangaroo care. And Wesley is joining us from Nigeria, and so far the tech and the link is working well. So we're keeping our fingers crossed that that's going to continue. Not only for Wesley, but for all of you in the audience that are also joining us from Nigeria. So welcome, Wesley. Second, we have Crystal Lamb, who is recruitment manager at Ambitious Impact, where she selects founders that go on to launch high impact charities through the Charity Entrepreneurship Incubation Program. Welcome, Crystal. Thanks for joining us. And last but not least, we have Dr. Sam Harvey, who's co-founder of Notify Health. So Sam is also a medically trained founder who launched Notify Health to improve uptake of childhood vaccinations in low resource settings. And Sam also recently actually switched and has joined the team at Ambitious Impact, who run the Charity Entrepreneurship Program. So he's got two perspectives that he can bring to the discussion today. So it's fantastic to have you all here with us. Thank you so much for spending the time. My name is Simon Ling. I am the Executive Director of High Impact Medicine. Many of you in the audience know me because we've interacted in one form or another over the last 9 months since I joined the organization. And I am going to try to facilitate what I hope will be a conversation with our three guests that's going to cover a bit of ground. And so we'll get started with my first question, which is to Wesley and Sam. What were your motivations for going into medicine in the first place? And why did you end up then reconsidering your career direction and heading in the founding direction? Who'd like to go first?
I can start us off if you like, Wes. Yeah.
Thanks.
Hi, everyone. Great to have you here. If you want to turn on your cameras, that would be nice as well, so I can speak to more of you. But totally up to you. That's great. So my answer is, I think probably more common than we would like to admit. Like I went into medicine when I was 17, without too much of a sort of moral drive or anything like this. I did it because it was a high prestige job to go into. And I think it is a really impactful and wonderful career. And I ended up liking it. But my initial reasons were, yeah, not driven by impact or by the wanting to do good. I enjoyed speaking with people and making them feel good, and I liked science. It was sort of a combination of these things, but there was no real sort of deep drive to do it. At the end of the day, my mum told me to, and so I did. Then I got introduced to effective altruism, and I have a very clear memory of sort of those ideas sort of eating away at me a little bit as I was walking around a ward in New Zealand with a team of four doctors as a junior doctor, and thinking, we're doing great work here, but these patients are generally, quite elderly, relatively well. At this point, I'd done a medical elective in Ghana, and I'd sort of seen what a really low income setting looked like in healthcare. And so, that made me think: am I adding the most value working in New Zealand? And I was, no dependents, young, and just quite flexible. And so I thought reconsidering my career at that point. was quite a viable thing to do. And I would love to go back to medicine as well. Don't get me wrong, medicine is great. But charity entrepreneurship has ended up working out quite well. So I think I'm here to stay. Yeah.
Great answer, Sam. Yeah, so I think a slightly different trajectory for me, probably pretty similar on the mum part, but I think I was quite interested in medicine from an early age, from doing work experience, so probably about 16, and I thought it was a wonderful career, real chance to mix the science and the kind of artistic elements of dealing with people that I thought was really, really beautiful. So it was actually a much more tortured process, I think, for me to move towards charity founding. Kind of started around 2022 with being introduced to some of the principles of effective altruism, and actually through some like high med talks that a friend was organizing at my university, I kind of started to think about alternative careers related to medicine that were potentially higher impact. And a lot of those I thought, I don't really think I'm that good at this, like perhaps doing medical research or moving into areas like pandemics. And heard a little bit about charity entrepreneurship, probably now about 2023, so after my first year of practicing, and I thought that seems like it could be a little more up my street, but the program I'm sure is like very, very competitive to get into, and I kind of put it off because I thought probably wouldn't have a shot. And I think kind of the idea continued to dog me for another year, and I thought, okay, I should apply. And actually, when I first got in, I thought I really still wanted to do an intervention that was very heavily medical, and I think on that year's cohort there weren't as many of those. So I deferred, and in the following year there was a chance to do kangaroo mother care, which deals with babies in developing countries, and I thought it seemed like a really fantastic fit. So I think for me it was a more difficult decision, but one now being on the other side of, I'm pretty happy about. But definitely still miss medicine from time to time. It's a great career.
Yeah, thanks, guys. Interesting family persuasion in decisions going into medicine. I think that's a reality for many people. Maybe something we'll come back to in terms of opinions when you made it clear that you were moving out of medicine again. We'll come back to that in a minute. Crystal, maybe you could talk a little about the qualities that you and Ambitious Impact have found to predict success as a founder of a highly effective charity.
Yeah, of course. Happy to. And I think on the mum part, my parents have hoped that I would become a doctor until I elected entirely humanities and social sciences things, and they were quite disappointed on that. So not alone there. Yeah, so I think so we've been running this program since in this current format, more or less, since 2018. And there are several traits that we've identified as being incredibly important and predictive in being a good founder. And I'm happy to go into them kind of briefly here and then like delve deeper into each of them if people have more questions on that. So the first thing, it's quite obvious, the first one, it's being very altruistic and very ambitious about that. And it's kind of in our name, ambitious altruism as well, that and ambitious impact, that yeah, like we want to find people who are not easily satisfied with the amount of good that they're doing. And you can see and hear like hints of this in Sam and Wesley's story as well just now. And people who are constantly thinking like, how can we do this better? And what is it that perhaps we owe to people in the world, being the sort of positions that we are in for each and every one of us. The second one is about results focused. So we know a lot of people who have a lot of great intentions in doing good, but whether that actually translates into actually doing good and actually helping people, that oftentimes sadly is a question in a lot of context. So we're also looking for people who are not who are not overvaluing good intentions, but really focusing on whether there's a real outcome in the actions that they're doing when it comes to doing good, when it comes to helping people. And then a third thing that's really important is having a startup sort of culture fit, what we call, which is the ability to move fast, to pivot fast, in a setting where there's perhaps very little resources that you can leverage. Perhaps there's not a lot of existing networks that's being built. Perhaps it means you're coming into an environment where you know very little about the cultures that you're going to be operating in. Perhaps you know very little about even the intervention, perhaps that you're about to implement, but having this like willingness to just get stuck in, learn, pivot, and finding out what works. Um, Another thing is scientific mindset and being evidence-based. So that again ties into what we mentioned earlier about results focused. So really having this deep respect for evidence, for what has been proven to work when it comes to these interventions. And then finally, for us, this is something that I'm personally really proud of, and perhaps Sam and Wes will also talk about this later as well, which is being really collaborative. I think our community has a real kind of uniqueness, I think, in this, where I've commonly seen founders in our Slack channels volunteering their time even for other organizations when they have a few spare hours in the week. It might be actually recommending certain funding opportunities to other organizations that they believe will be able to kind of use this funding more effectively than they are able to at the moment. So these things of like genuinely prioritizing impact as a whole, as a community, more than perhaps their personal achievement and even achievement for their individual, their organization. So yeah, just several things. Happy to go into them in more detail. And I guess one last thing I might mention is just related to them as well, which is the ability to make decisions that are high stakes, with relatively little information, but still being true to the evidence, true to making the most out of what is available. And I think this is a quality that perhaps a lot of medical professionals actually do have experience kind of leveraging. So yeah, that's from
Thanks.
me so far.
Thanks, Crystal. That's really helpful. Fantastic. I have two quick follow-ups, actually. One is just about the sort of breadth of duration of experience and nature of experience before people apply who are likely to be successful in the program. Our participants in high impact medicine span from medical students up to more senior physicians. Do you have a sense of the kind of experience you're looking for?
Yeah, good question. So, the short and quick answer is no. When we do vetting and when we do, which is our word for kind of selecting candidates, experience is one of the less important things that actually we look for. The sort of traits and qualities I've mentioned earlier are much, much more important. That being said, having experience, in the medical space, is incredibly helpful, as maybe Sam and Wes will weigh in later. I think it immediately builds kind of trust with your stakeholders, and it also gives you an edge in knowing a bit more about perhaps interventions that you're about to implement, depending on obviously what ideas you would be founding. But yeah, I wouldn't say because you're a medical student, you would just immediately rule yourself out from this.
Yeah, that's great. And one other thing, International Women's Day is coming up on Sunday. And unfortunately, one of your, what to me seems like your most successful founders, Lucia Coulter, who's medically trained, co-founded the lead exposure elimination project. She was unable to join us today, but I know that as the program, you've had many other successful women founders who are not medically trained. I wonder if you could maybe just speak a little bit about AIM's experience with women founders as well.
Yeah, for sure, of course. Yeah, I think I would highlight there are many charities that are founded by great women founders. There are two I think I'll highlight here specifically that I would like recommend people kind of look into. One is Lafia, Nigeria, and they specifically focus on contraceptive delivery, provision, and like education as well. And this is founded by Clow, and she was. I believe a new kind of undergrad, fresh grad when she founded. And yeah, they're doing great work and yeah, has incredible impact as well. And then another one I would also highlight is Anch. They also do kangaroo care in India. And this is founded by Supriya. Who also has some really interesting background. She did criminology research prior to this. Yeah, so as another example of just how widespread the experiences are of our founders.
Great, thanks, Crystal. Okay, let's move on. Maybe I can come back to you, Sam. Do you feel that your medical training provided you with transferable skills that were useful to you in your role as co-founding at Notify Health?
Yeah. Okay. Great question. So I'll separate the skills that we learn in medical training into, I guess, the hard skills, so the science and the sort of medical, like object level medical knowledge, and then the soft skills, interpersonal, patient skills, taking a history, making people feel comfortable, all of this. I would say that actually it's the soft skills that have been the most helpful and the most transferable. There is a lot of stakeholder management in starting a charity. When you work in starting a health charity, there are various government officials that you need to speak with. For baseline research, you need to speak with community health workers, nurses, doctors, to interview them and get the information you need to help design your program. And just comparing myself to some of my colleagues. So I co-founded with a wonderful guy called Daniel, who comes from a consulting background, and that's just a very different set of social skills. And I was far more comfortable in the room with all manner of stakeholders. And I think as in medicine, we just have to be quite attuned to make the person we're speaking with comfortable and open up. And that, like, by far and away, I'd say is the most transferable skill. Now, there are loads of others as well, which like just the ability to triage well, like the whole system of coming up with a differential diagnosis, and and potential investigations to differentiate between those, is kind of like a meta skill when you're running a charity and there is an issue and you have to figure out the underlying cause. I would also say we launch a lot of health related charities, and just having an intuition about how healthcare in general works, the job of a nurse and, what a doctor does, how various medicines work. Like this is the more hard skill. These object level things are really helpful. I like most of the charities we launch in health do end up working in low income settings. And I had, some exposure. I worked in a hospital in Ghana briefly for my elective. So I would give, even more encouragement for the doctors in the room who are from low income settings. Your understanding of the ecosystem is just gonna, like, real, and understanding of that context is just going to be absolutely vital as well. And that is like a direct skill that I think, a lot of founders are missing, and something we're potentially, interested in as well at AIM. So, double, yeah, for those of you from low income settings as well, doubly helpful there.
Yeah, thanks, Sam. I think maybe from the inside, we often forget that medical training is structured to include a whole sort of breadth of skills beyond just being a medical expert and medical knowledge. And you've mentioned several of them: the communication, the collaboration, the managing systems and people, and so on. So, yeah, really interesting perspective. Wesley, what kind of challenges did you encounter with moving out of medicine to your charity founder role? And then maybe because we started out talking about our family's influence on going into medicine, some of those challenges are professional, but also I wonder how your friends, family, and colleagues reacted to your plans.
Yeah, perhaps I could start with the professional and then move on to the personal. I think professionally, as what we're kind of told when we start the program is being a good founder requires being really good at 100 skills, and any one person will probably only have 5 or 10 initially. So I think the main thing is just trying to develop and learn a whole lot of skills that you aren't as used to, coming from a medical background, which are required in running a charity. And also, as Sam has said, triaging, so knowing which ones are more important to focus on at different times. And I think, particularly if you move, I think, from medicine to running a charity quite early on in your career, perhaps, it requires a lot more self-interrogation and perhaps self-reflection than I think, in an earlier stage of a medical career would, because you are exposed to high-level decision-making and you're much more alone in doing that. So that might not always be by nature of things being time-sensitive, but ultimately, at the end of the day, as a founder, you have to have and be able to make the final decision on things. Whereas in medicine, that kind of level of decision-making is generally usually more senior-led, particularly in ours. So I think that's been a real challenge, and being able to identify and actually have a structure for knowing, okay, what's gone well, what hasn't gone well, and why, and what could I have done to change that, and thinking about what the counterfactual would have been, taking different decisions is really helpful, but also having to accept that you can't always predict how a particular decision will pan out, and being comfortable with that is something that you have to get used to quite quickly. Personally, I think there was a pretty big split between how my family reacted and how my friends reacted. Most of my friends, even those in medicine, thought it was pretty cool and really exciting, and obviously hugely worthwhile. And were pretty curious about how it was going to work, but I think quite positive. I think my parents, by nature of medicine being a pretty stable career and having quite good long-term prospects, were much more apprehensive about moving to a charity, which I guess in many senses, as Crystal has described, is much more like running a startup and having to deliver results to get funding and therefore for your organization to continue to exist. So a lot more kind of apprehension about that, and of course spending extensive periods of time in contexts very different to where I've grown up to. But I think actually after the first kind of few months of them getting used to it, it's been quite positive, and I've been surprised by how much they've really kind of thrown their weight behind me and supporting what I'm doing. So I think, although it was something I was quite anxious about beforehand, how to talk to them about it and deal with that, it's been quite positive overall. Yeah.
Yeah, thanks. I'm interested in that issue when you sort of train in medicine and then you step out into this whole new world. And as you say, you maybe have 10 of the skills and you need 100. So you spend time reflecting on what hasn't gone so well and how you can do better next time. How do you stay positive and not feel the weight of what you could interpret as failures in a world where you're suddenly much more at sea than you were in perhaps a slightly more comfort zone within medicine?
Yeah, I think it's really difficult because by nature of doing this kind of work, I think your head's always a little bit above the parapet. So you're always kind of looking at what opportunities are out there, what are all other organizations doing? and there's a kind of natural, perhaps also as medics, like we all want to do really well in whatever we're doing and excel. There's a bit of a natural tendency to compare that's maybe not super helpful. So I think something actually that Sam told me just before I started was really focus on your wins and what's gone well. So like we started our pilot last week and we've opened a ward, and there's now babies being looked after receiving kangaroo care that previously weren't, and just trying to actually just take a moment and think, what does that mean? What does that mean for those babies' families? And just maybe stop and pause, I think, has been something that I found really, really invaluable. And take some time to celebrate the things that have gone well.
I'll add on. I'll add on if that's all right, Wes. I think the really good thing about charity entrepreneurship is the community, and like everyone who founds a charity goes through like really rough times. It's just the nature of it. But you're in a cohort of a dozen or more people who are going through the exact same, or maybe not the exact same, but similar like heights of challenges and level of emotion and ups and downs. And there's no way I could have started a charity outside of the context of AIM. And I think a big part of that is the community. And it's not only your cohort of a dozen or so people, it's the wider community of organizations that have come before you. It's likely whatever challenge you are facing at this point, we've launched over 60 charities now. Someone has faced it before. But also on the emotional side, like you will just create a community of people who care and understand about the challenges. Yeah.
Yeah, fantastic. Thanks. Some really wise advice there. I like the idea of focusing on the small wins, Wesley, that you commented on there. Yeah, great. Crystal, would you give us a brief overview of the Charity Entrepreneurship Incubator program? How does it work? What are the application selection processes like?
Yes, yeah, we'd be happy to. I'll walk through the rough kind of like program structure, and then Sam right now would probably know better than even I do, given that he now runs the program alongside Steve. So yeah, I'll walk through the application process, kind of the broad structure of the program, and then Sam, please feel free to just chip in anytime and add details to that. Yeah, so I'll start with the actual application process. So usually you start with a application form that takes roughly around 30 to 60 minutes to fill out. It ranges from person to person. And then what we do is we then invite people to complete a test task. And then there will be a recorded interview. Another test task simulates what it's like to be a founder in the day-to-day. And then a final interview. So those are kind of like the steps. What we do take care to do when we design this application process is that we really try to make sure that it's not only informative for us when we make decisions about fit, but also informative for the candidate on their potential fit with his career. That's something that we do take a lot of care in when designing these test tasks and interviews and interview questions and so on, because we do believe that the vast majority of people who apply to us are people who are very impact-minded and driven. And that means if they spend loads of time with us, they're not doing the great and impactful things that they could otherwise been doing. So that's one thing. And then on the actual program itself, the first 5 weeks is part-time. It is a part-time kind of book club. People gather on Saturdays and kind of go through some of the basics in our charity handbook. We've published a book a few years ago on how to found a high-impact charity. And so you walk through the book together. You kind of get to know the people that's going to be on your cohort. And then after that, you will have several weeks of online full-time engagement. It's going to be project-based. You learn loads of skills. And then you'll have 2 weeks in person in London, and that's compulsory. We pay for all the accommodation and travel, as well as a stipend as well. And then after that, many people do choose to then stay on in London for the remaining weeks. It's 8 weeks in total for the full-time part. And then some people do return back to where they're based originally. And that is when you're finishing up your report, kind of like pitching for funding, and getting the ball rolling from there on. Do correct me if I'm wrong, Sam, and feel free to add details.
Nope, that was perfect. Yep.
Cool. Yeah, and if people, should I go into a bit more detail of like the sort of skills that maybe people can expect to learn on the program? Would that be helpful?
Yeah, it'd be great.
Cool. Yeah. So I mentioned for kind of the first, I would say maybe 2/3 of the program, Sam, people would be kind of doing project-based learning where they're paired with someone else on the program, on the cohort, testing their co-founder fit with them, as well as kind of learning a specific skill on a specific idea. So that might be something like if Sam and I are on the same program together, it might be Sam and I were like working on a project that is, say, trying to put together budget of a specific idea. And say, for instance, this idea might be a kangaroo care idea, or it might be a policy advocacy idea on kind of reducing salt intake. And then after we work on that project together while testing the skill on this idea, we might then reflect back to the program team on how that project we thought went. And that kind of informs the program team in future pairings and future kind of mini investigation tests on how you might work with other people.
Nice. Yeah. So those first 5 weeks are all about getting to a place where we're confident in what charity you want to launch. So the idea that we've created research reports on, and a co-founder pairing. So all these projects are not only in service of building skills, but building your preferences for co-founders and ideas. That's like the main goal of those first 5 weeks. And they're like two massive barriers to starting charities in the real world. Like finding a high impact idea, right? Takes a lot of research. And we have a whole research team. This is like their dedicated job. And then finding a high quality co-founder, like, the outreach team gets candidates from way beyond where you would have in your internal circle to be able to find a co-founder from. So that's what the first 5 weeks are about. And then the last three are once we pair you with someone and an idea, it's about building that proposal to receive seed funding.
Yeah. And Sam, can you give us a quick fire of like all the sorts of skills that people might expect to learn in those first 5 weeks in that like project-based setting?
Yeah, absolutely. So there are some like really core skills that we think are quite important. So for example, there's a project on analyzing the research behind your particular idea and the strength of it and where the gaps are. Creating theories of change, which is like a flow diagram of how you go from what your charity actually does to how impact actually happens and all the steps along the way and where it can go wrong. How to build a monitoring and evaluation system. So in the nonprofit world, we need to track whether what we're doing is actually causing good in a way that the for-profit world, you just know whether you're making money or not, right? So there's this whole range of things called monitoring and evaluation, and we teach you how to set up a system for that, how to choose which geography to launch in, how to do something called weighted factor models, which is a spreadsheet tool to decide between hundreds of options and rank them across multiple different important factors in the decision. That's a handful. There's many more. And there are many skills that we don't cover because that's the nature of entrepreneurship. Is it's going to be different for every idea that you found. And you're not going to know what you need to know until you're out there in the real world. So we really are just giving you that lift and the support. And then, you are off into the world and everyone's experience is going to be different after the program as well.
Fantastic. Thanks, guys. Maybe you have some comments, Wesley and Sam, about how you found the program, what it was like. What's the experience like going through the program?
Yeah, I'm happy to discuss that. So I went through the program last summer. as described very well by Sam and Crystal. And I think it's just a hugely exciting time was the dominant feeling. You get to meet all of these new people who are really, really driven by trying to change the world in a positive way, which feels pretty incredible. And you're working on all these really interesting projects. So it's very cognitively demanding each day, but in a way that's pretty enjoyable. And I feel like the whole process helped me learn a lot more about some of my strengths and weaknesses, kind of coming from a point of not having done much or any of this stuff before. I think the pairing process is quite exciting. A lot of people call it or liken it to Love Island, which is, I think, an interesting analogy. But I think as you go through the weeks, so much happens in 5 weeks, and you go from starting the program not knowing anyone, for many people not being sure what charity they want to found, to 5 weeks in having a partner, and by the end of 8 weeks having a proposal that you put together and send out into the world. So it's hugely exciting, pretty tiring, and I think after that the kind of post-program support was really, really good. And I think it was something I was a little bit apprehensive before. I was kind of like, oh, the program seems really great, but then at the end of that 2 months, you're just kind of dumped out into the world and off you go. But actually the program and Sam and Steve provide lots of great specific support, some specific sessions, particularly around operational elements of getting a charity off the ground. And then, you've got the support of a really wonderful community. And I think being able to go into the office and be there every day during the program was really cool. So yeah, a good time. Yeah.
That's great. And then after the program, what's your typical working week like at First Embrace or at Notify Health? What does that look like?
Yeah, so it depends a lot whether I'm in Nigeria or well, whether I was in Nigeria or whether I was here in London. The truth is, it's hard to describe a typical working week because one of the facts about charity entrepreneurship is, like, honestly, particularly in that first year, my job description was changing week by week by week, which was really exciting, very stressful at the same time as well. But thinking once I had some more stability in the work, it involves a lot of often in the first year, you are creating something, right? You're creating a pilot, you're creating a needs assessment. And so there's a lot of program design that happens, which involves researching, other forms of of a similar program and deciding what to put in your pilot, writing, creating surveys to help the on the ground staff, interview caregivers to be important inputs into your program. There is a fair amount of and that involves a fair amount of like spreadsheet work, working in Google Docs. I would meet with my co-founder every day, at the start for an hour every day or so, and just be discussing back and forward program design, funding, all of this. Then once the program is running, there's a lot of reviewing data analysis. Once we hired staff, there was a lot of management and reviewing their work and creating goals and plans. There's the whole self-productivity side where, we have our organizational goals and then putting those into quarterly goals for myself, into weekly goals, into my day-to-day tasks. A real mix would be the take-home message, and it just changes completely when I was in country as well, which is full of meetings with our local implementing partner, going to health facilities and speaking to healthcare workers and nurses, going to government meetings, all a big mix. And that answer is going to be completely different for different charities as well.
Thanks, Sam. Wesley, how does your week look?
Yeah, I think quite similar to what Sam described. I think what I and my co-founder have tried to do is divide a little bit more some of the workflows. So somebody perhaps takes a lead on an element like monitoring and evaluation, and then maybe somebody else would do something more like recruitment. And I found that quite helpful. But I think at the stage that we're at and most charities are at, a lot of things are strategic, and so you end up discussing most of them together. So a lot of meetings, and I think what's quite nice about going through the program is that you don't have to worry about, for example, fundraising very much in the first year, which really allows you to set up your charity well, get a good foundation, get the right people in, think about how your program will run before you kind of need to, have results to justify it existing. So, yeah, I think being here in country in Nigeria, I've spent most of my days in the hospital for the majority of the day, and then a little bit of working from home on some organizational stuff, grant applications, hiring, and so on. And then going back home, you're kind of managing the program team more remotely. So we have a program manager who we meet with very regularly, and then kind of doing more organizational related elements, operations, monitoring and evaluation, and those kinds of things, and then planning for the future. Yeah.
Fantastic.
If I may, Simon, can I ask the two of them a question that I'm personally really curious about?
Yeah, go ahead.
What is something that, or what are a few things perhaps that you realize that you have a real advantage or edge in, given your medical background, when like after founding, in your work?
Yeah, I think I think I touched on some of these before. It's the interpersonal skills which help, like particularly with stakeholder meetings and like talking with beneficiaries. I think that's really great. Um, when you're starting a charity, you need to get meetings with people. It doesn't hurt to have the doctor in front of your name, to be perfectly honest. That's something which maybe my colleagues didn't have, like, quite frankly. And like people are just more likely to take your email, I guess. And then I suppose, yeah, just sort of having more of an intuition around like healthcare interventions and like how that is going to work and in a hospital, like just being able to have like what seems to us like common sense for whether something will work just it isn't common sense to people who aren't medically trained, I would say.
Yeah, I would echo that quite a lot. I think, particularly coming out here in Nigeria, there's a real sense of credibility and sense that people want to talk to you because you're a doctor, and perhaps that's in particular because I'm working on a healthcare intervention, but I think there's quite like a hierarchy based sort of society here that is quite well respected. And I think once you kind of get to the stage of running an organization where or you're doing things particularly like fundraising or trying to make partnerships more often, being used to, I think, speaking in a certain way, having done things like interviews and sort of selling your work, which I think is what a good charity has to do at a certain stage, are maybe skills that we're a bit more practiced at than the average person, perhaps coming from other backgrounds. So yeah, I think those are things I've noticed.
Yeah, thanks. Great question, Crystal. Um, I'm going to go to a couple of questions that have come up in the chat. I'm going to work backwards with them, actually. So this is from Fawzia Sanusi, who is in Nigeria, actually, I believe. And welcome to you, Fawzia. So question for Sam and Wesley. What has been your greatest challenge or struggle with starting your charity? How have you been able to overcome or handle it? That's the first part of the question. Maybe we'll just take that first.
Yeah. Gosh, there's been a lot of challenges. Which one do I choose? I think there was a big learning curve for me in terms of going from medicine, where it was quite clear what my role was. It was quite clear what my tasks for the day were. It was quite clear the hierarchy, like where the buck stopped. It went up, I had my registrar, then I had my consultant, and that was all very clear. In charity entrepreneurship, like how you spend your time is completely your own. And there are so many options for what you could do. And the world is so uncertain that it's just like really hard to know how to prioritize and whether you're on the right track or doing the right thing. And the way I suppose I got over like or helped with that is, I mean, it's just with time. Like you just become more comfortable. Like once you've done something lots of times, you become more comfortable with it. But putting systems in place to support that was particularly helpful. So putting in systems for goal setting and daily tasks. So I knew that every daily task I was setting myself was in some way linked to the final goal. And that helped with that sense of like, am I going in the right direction? Yeah. And having a great co-founder who was wonderful at strategic direction setting. I think that's something to highlight, right? Is you don't have to have all of the skills, right? Because the goal of the program is to find you a co-founder who can, complement you in those ways. And that's what I found with Daniel. Yeah.
That's great. Let's move on to another question from Naila. What support's available after the program? Any community meetings, mentoring options, support or guidance, for example, with pitches for further funding after your seed funding?
Great. So, I mean, I will be. Wes, actually, do you want to start? Because you've had the experience of this from Steve, and yeah.
Yeah, happy to. So there's really, really intense support in the kind of first few months with like mostly weekly sessions covering a real range of things. So simple operational things. How do you actually set up like a legal entity of a charity? How should you manage your finances? What kind of advisory board might you need? Kind of productivity focused elements from successful ex-founders. Also like kind of external support from people like monitoring and evaluation experts, mental health support. So there's a real kind of variety of those that are provided in kind of a structured way. So you basically got a timetable that spans the first few months. And then, after that, the kind of program team that you worked with, and Steve, who Sam has mentioned, who's one of the incubation program managers, always vary around, kind of have a channel where we communicate pretty regularly. And then I think the office is a really, really great resource because loads of founders will every day have lunch together and easy to discuss any issues that you're facing.
Great, thanks. Okay, next question's from Teresa Zacks, who was a participant in our career planning course late last year. Does running a charity bring enough money for you guys to afford a living, or do you have a side job? Really important practical question.
Yeah, so it's a great question. So yeah, and a bit complicated, and the answer differs depending on where you live and your needs and your family situation and so forth. I will be perfectly honest. Going from doctor salary in New Zealand to first year charity was a big drop. Now I didn't have any dependents, and I was able to do that. You just have to cut down, and this is the nature of seed funding. There's only so much available to go around, and what you spend on your salary, you can't spend on the program. That notwithstanding, I lived in London, and like a relatively expensive city, and yeah, I was able to get enough to live from the seed funding. And there are also founders with children who are able to get by as well. People have different needs, but it is not to the same level as being a clinician. I'm just going to be completely upfront about that. Particularly in your first year when your salaries take up like more than half of the expenditure of the charity. Now, that might change a little bit as time goes on, And yeah, so the answer was yes. Like, you don't have time for a side job. This is like, if you're going into it, this is what you're doing. Okay. And it was enough to live on, but yeah, not. I wasn't taking as many trips as I was when I was working as a doctor. Yeah.
Sam, can you maybe you have a bit more of an updated data on like how much average seed funding people get now when they pitch for it, so people have a rough idea. And by the way, we don't ever say this is only how much you can give yourself and your co-founder as salary. The organization is yours, the choice is yours. You own the results, you own these decisions. So yeah.
Yeah, that's right. Yeah, absolutely. The range, so the average is about 136K, and the range is somewhere from about 116 to 160 or so.
That's British pounds, by the way.
No, that's US dollars. That's US
that's
dollars.
US dollars. Sorry, that's US dollars.
Yeah.
Great, thanks. I'm going to squeeze in one final selected point of a question here and ask Wesley for a real quick answer, and then we'll wrap up before the hour's done. Wesley, you talked about needing structure for knowing what's going well and what hasn't. Did Charity Entrepreneurship provide that framework, or did you have to build it yourself? And how early on did that really matter?
Yeah, I think there was quite a lot actually in the program and kind of post-program documents that were shared around how do you reflect on things and how do you tie those into sort of your objectives and key performance indicators for your organization. I think what's much more difficult is to figure out how personally effective you've been in any particular situation, because it kind of requires you to compare what happened to the potential counterfactual, like what could have happened. And that's always very difficult, I think, because any situation is so multifactorial. So I think the way I've gone about doing that so far has been a lot through feedback with other people who were involved in any particular decision or situation. I think triangulating that with external experience of people like Sam, who, for example, has been in lots of situations I found myself in dealing with stakeholders in Nigeria, gives you a kind of a useful reference point. But I think ultimately what's the most difficult about this job is that there's no one particular template for how to do things and how to know really, like truly, if a situation or a decision went as well as it could have. And so you kind of have to accept that you try and figure out if it did go okay, and if not, how could it have gone better, and try and develop, the skills that you need or you see a gap for to always get the best outcome possible. And that's really a work in progress.
Excellent. Thanks, Wesley. So this brings us to the end of our hour. I found this incredibly interesting, and I really just want to thank Wesley, Crystal, and Sam for spending this time with us and sharing their thoughts, their experience, their knowledge of this really inspiring area. I have to say I'm in awe of what you're achieving through all of this amazing work that you're doing. So incredibly impactful, and I think really inspiring for everyone here in the audience, and hopefully for those that will view this online later.